ahead and start the webinar. For those who are unfamiliar with Zoom webinars, a couple of options you have. Across the top, you'll have an option to raise hand. This is if you have a question or maybe if there's a technical difficulty that you're having trouble hearing. There's also a chat where you can share information as well as a question and answer, and that will show up on my screen so I can see it. And then we'll be able to answer questions in real time. We also do have an audio question and answer section at the end of the presentation when we'll be opening up the audio to anybody who has a question or a resource they want to share. Something else I need to note about this presentation is that the slides have been done with vision loss in mind. So for those with low vision, all of the slides are a black background with yellow large print writing. If you have your computer set to invert colors, you may need to turn off that color setting in order to see it. So if you are a Zoom text user, the command for that is caps lock C, and that will allow you to revert the color to normal if you have inverted on and you're having trouble seeing the slides. This is also our first webinar, so I appreciate any patience if we have technical difficulties. We are learning right along with you, and so with that, we are going to go ahead and get started. And so the title of this webinar is Resources for COVID-19. By the way, I'm Jessie Traster. I am the Manager of Rehabilitation Services at Alphapointe in our office in Kansas City. Although Alphapointe is based out of Kansas City and New York City, this webinar is really meant to provide information on resources nationwide. So we are trying to really limit any geographic specific resources at this time. And when we get to the question and answer, if you have questions or suggestions about resources in your neck of the woods, that would be a great time to share those. So we're going to go ahead and get started. And so there's 3 issues that we are looking to address during this webinar that we have heard from our clients and our employees have been unique to those with vision loss during this time, and that's working and learning from home. Many workers have been asked to start working from home, and parents are being asked to educate their children at home. And with that, they may have varied access to accommodations or adaptive technology, or information may be getting to them in a way that is different from how they're used to and maybe not as accessible. A second issue that we have heard from people is being able to obtain necessities. Right now, we know that stores are low on staples such as toilet paper, certain types of food, and that can be a real difficulty when you can't drive and go from store to store. So we'll talk about what some resources are for being able to obtain those things that you need during this time. And then the last section will be on organizations that are going to be providing relief. So we'll go ahead and get started. So working, learning from home, there are some unique issues. The biggest one that we're seeing is accessing material. And how do you access if you're a student and now all of your learning is being done online, or people are sending documents in a way that they don't normally send them? You may not have access to your Braille embosser that you normally have. So how can you access material? And for those school students and parents of school students, I do see a couple of parents that I know on here. How do you make sure that your child has the educational accommodations and support during this time? So the first thing is, how do you access material? If you are not familiar with it, there is an organization called AIRA, A-I-R-A. They are similar to Be My Eyes. Many people are familiar with the Be My Eyes app, which connects you to a live person that can help with identifying things, reading them in your home or store, wherever you are. AIRA is sort of a professional level of that. What AIRA does is the app is free. You can download it on your tablet, your cell phone. If you go to their website, again, it's AIRA, A-I-R-A, and you type in your cell phone number, they will send you a link for the download. So the app itself is free. What is not free is the actual phone call with the person. So they have a call center, people who are trained in vision loss. And one of the benefits of Aira over the free app Be My Eyes is that Be My Eyes relies on volunteers who may not have had training in how to verbally walk somebody through something. But the other thing is that the volunteers have not signed confidentiality agreements. And we have heard some clients say that is a concern when they're trying to have somebody read something, they don't know what's on there. The Aira call center employees have all had to sign confidentiality agreements. So if you are dealing with sensitive information, you know that that information is safe. Now, what Aira is doing differently during COVID-19 is if you are a college student, they are offering you a free subscription at this time through the end of this semester, which ends in May. What we are seeing from college students that we work with is that because those offices of accessibility are shut down or maybe have limited staff, because professors who may not necessarily be comfortable with providing online instruction have had to very suddenly, very quickly switch to it, we're finding that people are having difficulty accessing that curriculum without somebody sighted helping them, that there may be graphs, charts, images that don't have any kind of description on them. That's where a service like Aira can come in handy. And so they are offering for free to any college student through the end of the semester. You will just need to email them. Again, go to AIRA, that's Aira, is their website, aira.com, and they will have an email address provided that if you are a college student or if you know of a college student who is having trouble accessing material at this time, they will be able to get that free download. Now, Aira is free to use at any of what they call their partner sites. So for example, Alphapointe is a partner site. Stores like Target or Wegmans are partner sites. So the subscription plan, if you are not a college student, is similar to an old-fashioned phone plan where you buy a certain number of minutes per month. And then you can call Aira. They will provide you with that description you need up to those number of minutes that you have purchased. If you're at a partner site, you don't have to use against those minutes, so you can still use the free version if you are at a partner site. Aira is also soliciting information from the blind public on what else they need during this time. So if you are a parent and you have especially those middle and high school students who are having trouble accessing that information, I encourage you to get in touch with Aira. If you are a worker, maybe not a school student, but somebody who has had to transition to working from home and the current technology you have is not cutting it, I would encourage you to go to Aira's website, AIRA.com, and contact them because they are soliciting that information to make decisions about what they might offer additionally to that free subscription for college students. Now, another service that is offering for free at this time is Freedom Scientific has made home licenses of JAWS, Zoom Text, or Zoom Text Fusion available through the end of June, through June 30th at this point. This is free to any person. Initially, it was just for students who maybe their schools had already purchased licenses for them, but this is now for any individual in the United States. If you are working from home and your home computer does not have this on there, if you are a parent of a student and maybe this was loaded on a desktop at their school but not on a home computer, go to freedomscientific.com. You will need to enter your email address and they will send you a link with a license for JAWS, Zoom Text, or Zoom Text Fusion that is active through June 30th at this time. Now, I will say that when you go to the website, it is a little bit confusing. The verbiage on it, when you first look at it, does make it sound like this is only available to K-12 students. You have to look a little bit further down to see that this has been made available to every person in the US who needs it. So don't let that scare you if you see it. All you need to do is enter your email address and they will send you a link. And then the two apps that we use at Alphapointe with our clients quite often, Be My Eyes and Seeing AI, are both free. So Be My Eyes has gained a lot of traction on social media. You've all probably seen the posts about this app that you can download. It connects you to a volunteer. So people can sign up to volunteer to assist a person with vision loss. So they point their phone at whatever it is that they are trying to access that is not accessible, whether it's a setting on a laundry machine, reading a package at the store, a piece of mail, and then it connects you to a volunteer who tells you what that is. The downside to this compared to IRA is that these are not professionals. So people may not have been trained on how to provide descriptions, so you may have to work with that. And also, as mentioned earlier, they have not signed a confidentiality agreement. Now, I've never heard of anybody having their information stolen by a Be My Eyes volunteer, but we have heard from clients that that is a concern they have, given the sensitive nature. But the nice thing about it is that it is a free app and has always been free, even before the COVID-19. The other app that we really like is Seeing AI, which of course stands for artificial intelligence. That is another free app you can use. And Seeing AI is probably one of the most accurate, most robust apps I've ever seen. And in addition to doing optical character recognition, where you can take a picture of the page and it will tell you, if you have no vision, you're trying to line up the page, it will tell you if the boundaries are within the range of the camera. It can do OCR for printed material. It can also read handwriting if the handwriting is neat. It can help you identify colors, currency, what is around you in the room or backdrop. Now, it's not going to be able to necessarily read you a chart or a graph if that is a concern that you're having, but it's pretty robust in other ways. And of course, it is a free app that you can continue using even after COVID-19 is over. We have some chat. And then I'm being told by Jim Fetgather, who's our adaptive technology instructor here at Alphapointe, that there is an Android equivalent to Seeing AI called Lookout. And I have not personally worked with Lookout, but Jim is recommending it, and Jim is our technology guru. So thank you to Jim. If you have an Android device, Lookout might be another option for you. So then the second issue that we're seeing with learning and working from home is educational support. A big topic of conversation recently has been how are districts responding? And we have seen very diverse responses to this current crisis. Some districts have transitioned to online learning through the end of the year. If the district is doing that, they are required to provide some kind of accommodations. Does not mean that the accommodations have to be online. It could be in the form of a written hard copy packet in large print or braille, but it does have to be accessible and it does have to be equivalent to what that online is doing. We have heard of some districts offering one-on-one instruction through special education using a service like Zoom, Skype, FaceTime, that type of thing. Districts are not necessarily, according to the Office of Civil Rights, being told that they have to provide the equivalent instruction in minutes that is on an IEP. They just have to provide that adaptive instruction in some way. Unfortunately, we are hearing of districts that have shut down education completely. They are saying that because they cannot offer an equivalent education to those with disabilities at this time, they are not offering any kind of educational services for any students. Now, the Office of Civil Rights and the Department of Education released guidance to school districts last week. This guidance basically said, we understand that districts have stopped instruction entirely because they're afraid of being able to meet that federal mandate for children with special needs. But they're telling them that's not the way to do it. You don't stop educating all children. They are offering districts additional flexibility. So where the conversation is headed is how do we provide accessible education and accommodations to our students? So right now, under the law, under the Individuals with Disabilities Education Act, all students with disabilities must be provided with a free and appropriate public education in the least restrictive environment. If a school district is providing any kind of instruction for students, then they must be providing that free and appropriate public education for those students with disabilities. The challenge becomes those students who need more hands-on. For example, a beginning Braille reader can be very difficult to instruct remotely. There are often times that I have to put my hands on a Braille student's hands to help them track properly, teach those appropriate hand movements. Orientation mobility may be another one that is very difficult or to provide remotely, or to make it safe to provide remote instruction. So the Office of Civil Rights is telling districts that they can be more flexible in their interpretation of the Individuals with Disabilities Education Act. They don't necessarily have to provide that video conferencing one-on-one. If they are not able to provide services, one of the things they're being told is that they can provide compensatory services next year to make up for lost instruction. So how your individual district responds is going to depend on how they are interpreting that guidance that came out on March 21st from the Office of Civil Rights, what their capacity is. Some districts, I have not heard of any in the Kansas City metro where we are based, that are looking at providing compensatory instruction next year in lieu of providing special services now. But that is an option that was given to school districts by the Office of Civil Rights. So if you are a parent, we encourage you to work with your school, work with your special education teachers. We have heard stories of parents having to take packets of work and adapt them on their own. I haven't heard of that here in the metro, but those are stories we have heard from around the country. Schools and teachers are scrambling to provide instruction in a way they never have before. And so they're learning with us. And as this situation continues to evolve, we may see that guidance from Department of Education and the Office of Civil Rights changing. So what the law requires in an extraordinary situation has changed a little bit. If I would continue to keep an eye out on the Department of Education website and your state's Department of Education website to see what their guidance is to local districts. And if you have a question, contact either your child's special education teacher or the assistant superintendent of special services, or whatever the title is that that specific school district has. If you're a parent and you are trying to work with your students, American Foundation for the Blind has an entire page on COVID-19, and they maintain a list of accessible resources that you can use with the children in your home. So this could be another really good resource for you as a parent. Now, in the guidance given to schools, the Office of Civil Rights did say that if they are providing any kind of online instruction, it is supposed to be accessible with adaptive technology. But later on in the same document, they said if you can't provide remote instruction online for a child with special needs, you can provide an equivalent education through another way. So this is something that we're seeing mixed messaging on from the Department of Education and the Office of Civil Rights. So hopefully those websites that you're working with are accessible. If they are not, make sure that you're talking to your child's teacher and telling them this is not accessible. What is something equivalent that you can give my child to do? The other thing that we are seeing is that if you are using the National Library Service, you are using their Braille or their talking books libraries, that you are getting materials mailed to you. Many of those have shut down for the time being. But if you have a membership, then you are eligible for Bard Mobile if you have not started using that yet. You can download Braille Ready files. You can download audiobooks. So you're still able to get books for your student or for yourself. And they do have apps that you can download on your cell phone or on your tablet. So if you're looking for books for your child to read or yourself to read, and you're not getting those physical books that you're used to getting, you can still go to Bard Mobile online and receive information that way. The next issue that we're hearing a lot of people say is that they're having difficulty obtaining necessities. There's been a run on the supermarkets. Places are out of toilet paper, they're out of paper towels, cleaning products. Some stores are even running short on shelf-stable foods. And so we have heard people say that they're having difficulty getting to the store, or when they get there, there's nothing they can buy. Not necessarily an issue of I can't afford it, but more I can't get it. So one thing that you do need to take into account are those transportation considerations. We are hearing reports that some transportation companies have greatly reduced their services or even stopped transporting entirely. We're also hearing reports that in some areas, prices of things like Uber have gone up significantly, which has placed a burden on people if they're trying to access that transportation to go to the store or to go to appointments. If you are not sure what the transportation situation is in your area, I would encourage you to make sure that you are either calling or using an app that your local transportation authority has to check up on the most updated information. For example, we know that in the Kansas City metro area, there have been some routes that have been changed. And last thing we want to have somebody do is waiting for a bus that isn't coming. Or if your transportation's been canceled entirely. If you're not sure what that situation is with your transportation company, if they have an app, I would download that app and use that, or call them and ask them what the restrictions are on rides or if they're still providing transportation. One thing stores have done to help those with disabilities is they typically have designated the first hour of their day to customers who have disabilities, who are high risk. Now, we've heard from some people around the country that because of the run on the supermarkets, places are not necessarily able to provide the assistance they normally provide in the form of a customer assistant. So again, I would call if you are wanting to do your grocery shopping in person, I would call the business directly and tell them this is the time I'm planning to come. Can you provide me with an assistant? That way you're not surprised when you get there. If you're looking for something specific, what I have found in our own adventures trying to help the people that we work with obtain necessities is that your larger stores are not able to provide you with information on inventory. You'll likely get routed to an automated message that makes it very hard to get to somebody because of the increased demand on stores. But if you call a smaller store, like a Price Chopper, a Hy-Vee, a local mom and pop grocery store, they're more likely to be able to answer your call and provide you with information. So if you're not sure about what's available in your area, I would encourage you to call that store directly to make sure they have what you need. We're seeing a lot of people move to online ordering and grocery delivery. So most major chains have a way that you can either order online and pick up. For example, Target does this. A lot of businesses in the areas have moved to curbside service. So you place your order in advance and then you pull up. You may have to present an ID or an email, a copy of the email that says who you are, and they will bring it to you. So you have it already. You don't have to go around the store. Of course, you would still need transportation to get there. You can also, if you're using a pickup, you can designate somebody. So if you can't get there, but you have a friend, a member of a civic organization who's helping you out, a family member, you can designate them as the pickup person. So that way they can get your groceries for you. And then apps like Shipt, SHIPT, or Instacart help you buy groceries from local stores, and then they will deliver them for you. Now, something to know is that right now the Instacart drivers are on strike. So getting delivery through Instacart may be more difficult. The strike, as far as I know, is just today. But if you're wanting to use it, that might be something you need to look at. The other thing that you can do if you're not using Instacart or Shipt is to look at your local groceries website. So Target, Walmart in our area, Hy-Vee are all starting to offer delivery where they maybe hadn't before. And so that can be another way that you can get your groceries rather than having to go to the store yourself. Now, you do have less control if you use a delivery or a pickup over what you're getting. We've heard people say that even with that, they're still not able to get some of those paper goods like paper towels, toilet paper, any of your cleaning products are in high demand. One trick that we've seen is to set your delivery for approximately 1 to 2 hours after the store opens for the day. That makes it likely that the most likely that you'll be able to take advantage of the restocking they are doing overnight. So the earlier in the day that you order and you get your groceries delivered, the more likely they are to have those really high in demand items. And if you have not done this online delivery before, you can also tell them what you're willing to have substitutions on, and then what you don't want substitutions on. If they're out of a specific brand, no, I don't want you to put an off brand in my cart, for example. The other thing that you can do to obtain necessities is reach out to civics groups, Lions clubs, or if you have the app Next Door, which connects you to people in the neighborhood. If you are in an area with limited delivery, limited transportation, you're having trouble getting where you need to go, a civic group or reaching out to your neighbors through a Next Door app can be another way to connect with people if you don't have a friend or family member that can help you get those necessities. So the third issue that we've been seeing is I have lost my job, my hours have been cut, the places that I depended on to help me out are starting to shut their doors. How do I get relief? So one of the things that we did last week when we found out that people were having difficulty obtaining food was we reached out to our local food pantry here in Kansas City. Some food pantries are starting to offer delivery services. So for example, here in Kansas City, we have an organization called Foster Adopt Connect. One of the services they run is a food pantry for foster and adoptive parents. And they said last week that they are no longer doing in-person services. Instead, they are delivering now. Because they serve a very small segment of the population, they're able to do that. Other food pantries are not able to deliver at this time. But what we have heard is that if you call them, tell them what your needs are, they might be able to help you find somebody, or they might consider doing delivery. So they need to know that need is out there. But if you are having trouble getting to a food pantry, call your local food pantry, ask them if they do delivery. If not, ask if you can have somebody go and pick it up for you if you don't have a way to get there. Guidance from federal and state governments as far as utilities, rent, and bills has instructed your utility companies not to turn off utilities if a person is unable to pay due to COVID-19. They've also instructed landlords and mortgage companies to not charge your mortgage or to charge rent during this outbreak. This is a very patchwork system, so the regulations are going to vary by area. One of the things that we are hearing is that you have to be able to demonstrate that your income has taken a hit due to the COVID-19 virus. So if you say, I'm having trouble paying my bill, and you don't tell them it's because of COVID-19, it may be harder to get the resources that you need. So when you call a company, if you are asking for them to waive your rent, your mortgage, your utility bills, your credit card payment, whatever it might be, you need to tell them up front, my income has been cut because of COVID-19. How can you work with me? The other thing to keep in mind is that this does not waive the payments necessarily. You might still be responsible for paying that amount of money when it's over. Some states have told companies that if you, for example, have a mortgage, that it's not supposed to raise your average monthly payment. But again, this is a very patchwork system. So talk to your company and say, what are my obligations when this is over? What are my obligations to pay back? If you have a loan that ends in June of next year and you can't pay for 3 months, can the bank extend that by another 3 months so that you're not having to pay more or a lump sum to bring you up to date? So you'll need to work with those companies and be very proactive so that when the outbreak is over, you're not being expected to make a large payment. If you're not sure what is available in your area, the United Way in many areas runs a helpline. And so you can, and if you're in the Kansas City metro, it's 211. If you're calling from elsewhere, if you go to the United Way's website, they can tell you what that helpline is so that you can get help. They're run by staff that have a database. You tell them what the need is, and they have a list of agencies that are providing services. One thing that I caution when you're calling a helpline like that, whether it's United Way or if you have another clearinghouse of some sort in your area, be concise and be specific about what you need. So for example, if you call United Way in the greater Kansas City metro, and the first thing you tell them is, I'm blind, when they type that into their computer, it's going to pull up Alphapointe. And so it might be that you need help with food or housing, but because they typed in that the person is blind, it's going to pull up an organization that doesn't necessarily provide help with housing or food. So when I refer people to United Way, what I always tell them is be specific about what the need is. Is it that you don't have food, that you don't have transportation to get to or from the doctor, that you're in danger of losing your housing? Don't bring up extra information like vision loss unless it becomes necessary. Or if you're trying to find an organization that's specific to vision loss. That's going to give you the best results as far as finding agencies local to you that are able to help you. The other type of relief that we have seen is relaxed unemployment rules. These rules have now been expanded to include people who are self-employed, workers in the gig economy. So if you have taken an employment cut, don't assume that just because you did not qualify for unemployment before this happened, that you will not qualify now. This is being administered by states, so you will need to go to your state's website or call them to find out if you qualify for unemployment. And the process we are hearing is supposed to be expedited. Now, with that being said, we saw 3.3 million unemployment claims last week. There have been issues of state websites crashing, of hours-long wait times, so you may have to be a little bit patient. But if you are finding that your hours have been cut or you have lost your job entirely or you've been furloughed, go to your state's website or call your local state agency that handles unemployment and find out if you qualify. And of course, Alphapointe is here to help as well. So you talk to Freedom Scientific, you get yourself or your child a download of JAWS or Zoom text and you're not sure how to use it or you're having trouble, we can provide adaptive technology training. We encourage you to reach out to your counselor if you have an open vocational rehab case. If you need help with a note-taking device such as a Victor Reader Stream, an Olympus recorder, anything like that, we can also assist you with learning how to use that device. If you're trying to use the accessible features on your cell phone or your tablet, or your child's cell phone or tablet, that is something else that we can do some remote instruction with you on. If your school is struggling to provide education at this time, Alphapointe is able to provide remote instruction. Now, we cannot do certain things. For example, we're not going to be able to work with your student on safe street crossings if that's a goal on their IEP. It's not safe for us to do that remotely, but we can certainly work with them on things like concepts related to orientation, mobility, adaptive technology, remote instruction in Braille. And we can provide tutoring for students and for parents. If you are trying to teach your child how to read Braille or what appropriate hand technique is, you're wanting to learn more so you can work with them in the home, we can also provide consultation for parents on that. So if you are interested, if you go to alphapointe.org on our website, we have a form you can fill out that goes to us, and we can certainly help you with any needs that you have during this time and work with you on how you can continue working, living, and learning during the COVID-19 outbreak.